Welcome to the home stretch. Dr. Seth King, I'm a physical therapist here in Rochester Hills, Michigan, and I wanted to talk to you a little bit about jaw pain. One of the things that I have noticed right away when working with patients wearing a mask and gloves all day is that my jaw, and my mouth even, is not moving as much as it normally does. And one of the things that has been happening to me at least is I've been getting some jaw pain right in the TMJ area, the temporomandibular joint. So what I want to do is I want to show you two areas of your head and of your jaw that you can work on yourself while you're at home to improve pain, to improve mobility in your jaw. Now the first thing is we have to look at the muscles, all right? Now I love muscles as a physical therapist. This is something that, I work with muscular and skeletal problems all day long, but the muscles in the jaw, two of the main ones that really provide kind of the clenching forces that afflict a lot of us are the masseter, the muscle right here, and you can find that really easily by closing gently your mouth and squeezing your teeth together with your hands on the kind of the curvature of your jaw there. You should be able to feel that muscle kind of pop into your hands. So the masseter and the temporalis. So again, what I want you to try to do, just so you can find this, is kind of go up from, in my case, the sideburns right above and in front of your ears. And I want you to, again, clench your jaw gently a couple of times. You should feel a little thin, small little muscle up in there. And both of these muscles, when tight and when not being used to their normal extent, can get really tight and can cause a little bit of pain. And so a really easy thing that was showed to me years ago by a temporomandibular specialist that helped me through some of my jaw pain is basically a self-massage for these areas. And so one thing, the main thing to know is where are these muscles, and you should be able to find them with what we just described. But two, can you get in there and regularly throughout your day massage that area? And so what I'd like you to do is relax, put your tongue on the roof of your mouth, and I want you just to take firm hands, firm fingers here, and see if you can get into some of the tight tissue in your masseter. And I would do this on both sides. You could go alternating hands. You can do a lot of different techniques here, but this type of self-massage technique is extremely effective at unlocking some of the mobility restrictions in the jaw and also just providing a little bit of relief. Similarly, in your temporalis, this muscle that we identified up here, what I want you to do again is see if you can feel around and find some tight areas. All right, so when I say tight areas, that's probably not the right word. Find some sensitive areas. So areas where when you put a little bit of pressure into them, they feel a little bit more painful than what you'd expect it to. And again, what you can do, relax, put the tongue under the roof of your mouth, and see if you can just kind of work gently or firmly into some of that tissue for 1 to 2 minutes. Both of these techniques are very effective at calming down pain in the jaw. I'd love it if you try it out. Obviously, this is not the only thing that you do for a temporomandibular joint problem or a TMJ problem, but I find them very effective when I prescribe these exercises to patients to do at home.